Hello everyone. Do you find your vision getting blurrier and blurrier? Does it feel like there's a thin fog in front of your eyes? At night, are lights unusually harsh with a glowing halo around them? This could very well be a cataract. Don't worry. In the next 10 minutes, I'll walk you through exactly what a cataract is, how to recognize it, and what to do about it in plain language. Let me start with 3 numbers so you understand how common cataracts really are. First, according to the American Academy of Ophthalmology, more than 24.4 million Americans age 40 and older have cataracts, and by age 80, more than half of all Americans either have cataracts or have had surgery for them. Second, worldwide, the World Health Organization says cataracts cause blindness in about 17 million people. That's nearly 40% of all global blindness. Third, cataract surgery is the single most common elective procedure in the world. More than 28 million operations are performed each year. Cataracts are extremely common. They are not rare, they are not a terminal illness, and they are not something to fear. So what exactly is a cataract? Think of an old window pane. Over the years, the glass yellows and becomes foggy. Light can still come through, but the picture on the other side looks washed out and blurry. The inside of your eye has a transparent lens, just like that window. When you are young, the lens is crystal clear. As you age, the proteins inside it slowly clump together. The lens gradually becomes cloudy, yellow, and hard. Light can no longer focus cleanly on the retina. That is a cataract. It is not a scary disease. It is simply your eye getting older, the way hair turns gray. Here are 7 signs that your cataract may be developing. Check yourself against this list. 1. Blurry vision. Your glasses used to correct everything. Now, even with glasses, things stay fuzzy. 2. Glare. Streetlights and oncoming headlights feel painfully bright, and you see halos or rainbow rings around them. 3. Trouble seeing at night. Daytime is fine, but as soon as the sun sets, you can't make out details anymore. 4. Faded or yellowed colors. A white shirt looks slightly yellow. Reds and blues look muted. 5. Double vision in one eye. You see 2 images overlapping, even with one eye closed. 6. Frequent prescription changes. The glasses you bought a few months ago no longer fit. 7. You need a brighter and brighter lamp just to read. If you check off 2 or 3 of those 7 signs, it's time to book an appointment with an eye doctor. Finding a cataract early is not urgent, but checking early buys you peace of mind. Now let me say something important, because many older people worry the moment they hear the word cataract. If a doctor diagnoses you with cataracts, do you have to rush into surgery? The answer is no, not necessarily. According to the American Academy of Ophthalmology's preferred practice pattern, the best time for surgery is not the earliest and not the latest. It is the moment when the cataract begins to affect your daily life, but before the lens becomes overripe. The exact timing should be judged by a qualified ophthalmologist. So if your vision has not significantly declined, and you can still cook, read, walk, and watch TV without trouble, you are not in a rush. This is called watchful waiting. During this phase, please do 4 things. First, see your eye doctor every 6 to 12 months for a slit lamp exam and a refraction check. Second, get an updated glasses prescription. Early cataracts often shift your prescription. Third, wear sunglasses with UV protection when outside. Ultraviolet light speeds up lens clouding. Fourth, quit smoking and keep your blood sugar and blood pressure under control. But please remember this. Watchful waiting does not mean never having surgery. The moment your vision starts impairing your daily life, you should be re-evaluated by a professional. When the time is right, do not delay. So, when cataracts really need treatment, what works? Here is the honest truth. The only effective treatment for a cataract is surgery. There are many advertisements for eye drops, eye patches, and supplements that claim to cure cataracts. None of them can actually reverse a cataract. At best, they make you feel like you are doing something. The only way to restore clear vision is to remove the cloudy lens and replace it. Many people become nervous when they hear the word surgery. Let me walk you through what modern cataract surgery actually looks like. You will feel much more at ease afterward. The most common technique today is called phaco emulsification, with intraocular lens implantation. The name sounds complicated. Here it is in plain words. Step 1. The surgeon makes a tiny incision at the edge of your eye, less than 3 millimeters, about the width of a sesame seed. Step 2. A thin probe goes in and uses ultrasound waves to gently break up the cloudy old lens. Step 3. The fragments are gently suctioned out, like using a vacuum. Step 4. A new foldable, crystal-clear artificial lens is inserted through the same tiny incision, and it unfolds into place. The whole procedure is basically swapping out an old foggy window for a brand new clear one. How safe is it? Here are 4 facts. 1. Each eye takes about 15 to 30 minutes. It is an outpatient procedure, no hospital stay required. 2. Anesthesia is done with numbing eye drops. You feel almost no pain. 3. Your vision starts improving within a few days. Full recovery takes 4 to 6 weeks. 4. Cataract surgery has one of the highest success rates in all of medicine. Serious complications occur in well under 1% of cases when performed by a qualified surgeon. Here is another important point. Many older adults believe that diabetes, high blood pressure, or heart disease rules them out of cataract surgery. That is a myth. If these conditions are well controlled, cataract surgery is usually safe. Your ophthalmologist will evaluate you carefully before the procedure. Talk to your eye doctor first. Do not talk yourself out of it. After surgery, there are 6 things you need to do. 1. No heavy lifting, no bending over, no forceful coughing or nose blowing during the first week. 2. Keep water out of the eye for the first week. Be careful when washing your face and hair. 3. No swimming for 2 to 3 weeks. 4. Use your prescription eye drops on schedule. This is critical. It prevents infection and inflammation. 5. Do not rub your eye, even when it itches. 6. Show up for every follow-up. Visit your doctor's schedules. If you do these 6 things, the vast majority of patients recover beautifully. Finally, when do you need to see an eye doctor without delay? If you notice any of the following, please schedule an eye exam as soon as possible. 1. Your blurry vision is starting to interfere with cooking, watching TV, reading, or walking. 2. You cannot see clearly while driving or walking at night. 3. Lights feel painfully bright, with halos you cannot ignore. 4. You have started falling or bumping into things more often. This is very often related to vision loss. One more piece of advice. Everyone age 60 and over should have a full eye exam once a year. Waiting until something feels wrong is usually waiting too long. A yearly check is cheap insurance for another year of peace of mind. Let me leave you with 5 sentences worth remembering. 1. Cataracts are not a death sentence. They are simply an aging eye. 2. If your vision is not affecting daily life, watchful waiting is appropriate. See your eye doctor every 6 to 12 months. 3. When surgery is truly needed, do not delay. The operation takes 15 to 30 minutes, is outpatient, and is almost painless. 4. Diabetes, high blood pressure, and heart disease are not disqualifiers if they are well controlled. 5. Age 60 and above, please get a full eye exam once a year. Seeing your family's faces clearly, watching your favorite shows, and walking safely, these are all worth having. Wishing you good health and bright, clear eyes. If this episode helped you, please like, share, and subscribe. Please send it to the seniors in your life. See you in the next episode.